Are you taking any of these medications? Beware, some common prescriptions might be doing more harm than good to your heart. Welcome to today's important discussion on heart health and the potential risks associated with common medications. Many prescriptions that are part of our daily lives can secretly affect our heart's well-being. Understanding the side effects of these medications is not just a precaution, it's a necessity. Stay with us as we unveil 10 prescription drugs that could be secretly undermining your heart health. Don't miss this vital information. It could literally save your life. Number 1. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are among the most commonly used medications worldwide. They include well-known over-the-counter options like ibuprofen and naproxen. Primarily used for pain relief, inflammation, and fever reduction, NSAIDs are a staple in many medicine cabinets. However, their widespread use comes with significant cardiovascular risks, particularly when used regularly or over long periods. NSAIDs can raise blood pressure and increase the likelihood of heart failure. This happens because they reduce the production of substances that help keep the blood vessels dilated. When these vessels are constricted, blood pressure can rise, putting additional strain on the heart. For those with existing heart conditions or high cardiovascular risk, this can be particularly dangerous. If you rely on NSAIDs for managing pain or inflammation, it's crucial to discuss alternative pain relief options with your healthcare provider that might be safer for your heart. Number 2. Antidepressants. Antidepressants are vital medications for treating depression and various other mental health disorders. However, certain types of antidepressants, particularly tricyclic antidepressants and some selective serotonin reuptake inhibitors, SSRIs, can have unintended effects on heart health. These medications can impact heart rhythm and lead to an arrhythmia, a condition where the heart beats irregularly, either too fast or too slow. The risk is generally higher in individuals with pre-existing heart conditions, but it can potentially affect anyone. These changes in heart rhythm, while often mild and manageable, can occasionally lead to serious cardiovascular complications. Therefore, monitoring heart function is crucial for patients on long-term antidepressant therapy. If you're prescribed antidepressants, ensure regular follow-ups with your healthcare provider to monitor your heart's health. Discuss any concerns you might have about your medications, and never hesitate to ask if there are safer alternatives or the need for additional heart monitoring. Number 3. Diabetes medications. Diabetes medications are designed to manage blood sugar levels effectively, but some of these drugs can also have unintended effects on cardiovascular health. Certain medications used in the treatment of type 2 diabetes, such as thiazolidinediones and some sulfonylureas, have been associated with an increased risk of heart disease. These drugs can cause weight gain and fluid retention, which can stress the cardiovascular system, leading to complications such as heart failure or exacerbation of existing heart conditions. For patients managing diabetes, it's important to consider the broader impacts of your medications on overall health, particularly heart health. Regular cardiovascular screenings and discussions about the potential heart risks associated with diabetes medications should be a part of your healthcare routine. If you have concerns about the medications you are currently using, consult with your healthcare provider about potentially safer alternatives that provide effective blood sugar control with a lower risk to your heart. Number 4. Calcium channel blockers. Calcium channel blockers are a class of medications commonly prescribed to treat high blood pressure, angina, and certain types of arrhythmias. These drugs work by preventing calcium from entering the cells of the heart and blood vessel walls, which relaxes the vessels and reduces blood pressure. While effective for their intended uses, calcium channel blockers can sometimes negatively impact heart function, particularly in patients with a history of heart failure. It's crucial for individuals taking these medications to be aware of the potential side effects, including the risk of heart complications. Symptoms like sudden weight gain, swelling of the feet or legs, or increasing shortness of breath should prompt immediate medical consultation, as these can be signs of heart failure exacerbation. Regular monitoring with your healthcare provider is essential to ensure that the benefits of taking calcium channel blockers outweigh the risks, and adjustments can be made to the treatment regimen if necessary. Number 5. Migraine medications. Migraine medications, particularly triptans and ergotamines, are specifically designed to alleviate the severe pain and symptoms associated with migraine attacks. While these drugs are highly effective for many sufferers, they also carry potential cardiovascular risks that should not be overlooked. Triptans, for instance, cause constriction of blood vessels to relieve headache symptoms. This vasoconstriction can also affect coronary arteries, potentially leading to heart-related side effects especially in individuals with underlying heart conditions. Similarly, ergotamines, another class of migraine medications, have been linked to more severe cardiovascular side effects, including increased risk of heart attack and stroke in predisposed individuals. Due to these risks, it's vital for migraine sufferers with known cardiovascular issues or risk factors to discuss their treatment options thoroughly with a healthcare provider. Alternative treatments or preventive strategies might be recommended to manage migraine safely without compromising heart health. Number 6. Cancer chemotherapy drugs. Cancer chemotherapy involves powerful drugs that target and kill rapidly dividing cancer cells. However, some of these chemotherapeutic agents can also have deleterious effects on the heart, a risk known as cardiotoxicity. Drugs such as anthracyclines are particularly notorious for this side effect, which can range from mild to severe, including heart failure, arrhythmias, and myocarditis. The risk of cardiotoxicity depends on several factors, including the type of chemotherapy, dosage, and an individual's underlying health conditions. Patients undergoing treatment with cardiotoxic agents are often closely monitored with regular heart function tests, like echocardiograms or EKGs, to detect any early signs of heart damage. It is crucial for patients and healthcare providers to balance the effectiveness of chemotherapy against potential risks to heart health. Proactive measures such as using cardioprotective drugs or adjusting chemotherapy dosages can help mitigate these risks while effectively managing cancer. Number 7. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are a class of drugs widely prescribed to reduce stomach acid, treating conditions like gastroesophageal reflux disease, GERD, and peptic ulcers. While PPIs are effective and generally safe for short-term use, long-term use has been linked to several potential heart-related risks. Studies suggest that chronic PPI use can increase the risk of heart attack, particularly in those with underlying heart conditions, possibly due to changes in blood vessel function or an imbalance in electrolytes affecting heart rhythm. Given these concerns, it's essential for individuals on long-term PPI therapy to discuss the benefits and risks with their healthcare provider. Alternative treatments such as H2 blockers or lifestyle modifications may be recommended to manage acid-related symptoms more safely. Regular monitoring and periodic evaluation of the necessity of continuing PPI treatment can help mitigate potential risks to heart health while managing acid-related conditions effectively. Number 8. Hormone therapy. Hormone therapy, commonly used for conditions like menopause, prostate cancer, and hormone replacement in transgender individuals, can significantly impact cardiovascular health. Estrogen therapy, for example, has been linked to an increased risk of blood clots and stroke, especially when taken orally. These risks are particularly pronounced in women who smoke or have a history of heart disease. For men undergoing androgen deprivation therapy for prostate cancer, there's an increased risk of heart issues, including heart attacks and strokes, due to changes in cholesterol levels, increased fat mass, and insulin resistance. It's crucial for patients considering hormone therapy to discuss all potential cardiovascular risks with their healthcare provider. Monitoring cardiovascular health before and during hormone therapy is essential. In some cases, switching the method of administration or adjusting the hormone dosage can help minimize risks. Individualized treatment plans that consider both the benefits and potential side effects are vital for maintaining overall health. Number 9. Decongestants. Decongestants are commonly used to relieve nasal congestion, typically associated with colds, allergies, and sinusitis. While they are effective in clearing nasal passages, they can also pose risks to heart health, particularly for individuals with pre-existing heart conditions. Decongestants such as pseudoephedrine and phenylephrine work by constricting blood vessels to reduce swelling and congestion in the nasal passages. However, this vasoconstriction can also increase blood pressure and heart rate, potentially leading to cardiovascular issues like arrhythmias or heart attacks, especially in those already at risk. It is important for patients, especially those with hypertension or cardiovascular disease, to use decongestants cautiously. Alternatives such as nasal saline sprays or steam inhalation may be safer options for managing congestion without significant cardiovascular risks. Always consult with a healthcare provider before using decongestants to ensure they are safe for your specific health conditions. Number 10. Weight loss drugs. Weight loss drugs are designed to help individuals lose weight by reducing appetite, increasing metabolism, or inhibiting fat absorption. While these medications can be effective tools for weight management, some carry potential cardiovascular risks. Drugs like sibutramine, previously used for weight loss, were withdrawn from many markets due to increased risk of heart attacks and strokes. Other medications such as orlistat and newer agents like lorcaserin also warrant careful monitoring due to their effects on heart rate and blood pressure. For those considering weight loss medications, it's critical to have a comprehensive evaluation by a healthcare provider. This evaluation should assess cardiovascular health and potential risk factors. Patients should also be monitored regularly while on these drugs to ensure any adverse effects on heart health are detected early. Effective weight management should ideally combine medications with lifestyle changes, such as diet and exercise, to minimize risks and improve overall health. In today's video, we've explored how common medications like NSAIDs, antidepressants, diabetes medications, calcium channel blockers, migraine medications, chemotherapy drugs, PPIs, hormone therapy, decongestants, and weight loss drugs can impact heart health. While these medications are necessary for many, they come with risks that should not be overlooked, especially for those with pre-existing heart conditions. It's crucial to consult with your healthcare provider to discuss any potential risks and find the safest treatment options for your specific needs. Always prioritize your heart health when considering any medication. If you found this information valuable, please like, subscribe, and share this video to spread awareness. Stay tuned and stay healthy by keeping informed with our content.